I'm planning a regional flap like the one that I've designed. This is not a radial, not a radical flap design.
This patient who is post-CA status, which means he had a cancer of the cheek, CA buccal mucosa of the left side, and now he has come to us for a soft tissue reconstruction which can restore the profile of his face to a certain extent. So we plan to do a soft tissue reconstruction using nasolabial flap, and although the results that we are expecting are not going to be like it's not going to give him fullness, but he definitely will be looking much better than what he is looking now. And we are going to do some so his mouth opening is limited. He has some fibrosis. We're going to release that intraorally so that his mouth opening increases. So overall, this procedure of releasing the fibrous bands, a fibrotomy will be done inside the mouth, and the other soft tissue procedure will be done. Tissue will be taken from this part of the face and tunneled inside to fill the soft tissue defect.
You can see a deep puckering defect here. So all of this mucosa was excised. You can also see some scars on his neck from his neck dissection. He also had radiotherapy. His cancer has been cured, but he's left with a functional issue of not able to open his mouth well. That's his maximum mouth opening right now. You can see that I'm yanking it hard, and that's the best. It's like 1 centimeter and something. Give me a scale. I'm going to show you the mouth opening that's currently there. So see that? That's 1.5 centimeters. And plus this puckering. I'm planning a regional flap like the one that I've designed. This is not a radial, not a radical flap design, but it's a simple flap, a modification of the nasolabial. The facial artery is missing from the neck dissection, so it's going to be a random pattern flap. But I don't need a big length because I show you the tethering from inside. If you can give me a tongue depressor. So it's very, very fibrous. I can hardly put my fingers in there right now. So you see this? It's really hard. I can't even put my finger. So we'll have to open the space up and try to get that tissue in between. Turn this light off. So you see here a large swelling here because they removed the buccal mucosa from there. His face is much more symmetrical, and well, that's not the main reason why we've done the surgery, but he's got improvement in his facial aesthetics as well. This is something which is very essential, very important. As we improve the function of the patient, whether it be mouth opening, chewing, breathing, speaking, any function on the face, seeing, we also try to make sure that the facial aesthetics only improves, and this procedure has done that for him exactly. And so he's got a nice, almost symmetrical face. There's a small puckering down there, but that's also going to improve, and his mouth opening has been restored. Thank you, guys.
Today is day 4 after after reconstructive surgery, as we call it. So as you can see this pre-op picture here, he had a carcinoma of the left buccal mucosa, and he has already undergone neck dissection, post-op radiation, chemo, everything is done. His post-op carcinoma status is he is disease-free, he's cancer-free completely. But when he came to us, he came to us with complaints of puckering over the left cheek. You see this depression right here and inability to open the mouth. So his mouth opening was less than 1 finger breadth, only 1 finger could go in. But now today is day 4 after surgery. I'm actually going to remove these tapes and show you. We've done a nasolabial flap reconstruction. So you see these stitches are still intact right from the eye, okay, till the base here, and this is where we tunnel the flap inside the mouth so that we can give him the bulkiness that he desired over the left cheek. So no more this puckering, which was right here in this region, will settle down. I mean, it's gone now, but this swelling here will settle down. Also, let me show you intraorally. I don't know how much you can appreciate. Why Toranga? So you see, firstly, his mouth opening is almost 4 finger breadth, and the flap inside the mouth is tunneled right here. The sutures are all intact. Can you see inside? So the flap is all healthy, vital, and since he stays not far away, we intend to call him back for suture removal on day 7. He doesn't have anything to worry about as of now, and aesthetically he's already looking really good. It was a challenging surgery because the facial artery rests right below, so there is a chance of immense bleeding that could occur if we injure the facial artery, but nothing of that sort happened, no complications as such. Again, in short, this is a nasolabial flap reconstruction for a carcinoma left buccal mucosa defect that we have done. Post-op day 4, patient is getting discharged. He will be again coming for a review on day 7. We'll be removing the sutures and we'll show you how he looks after the suture removal.